Hi, I'm Dr. Diane Decker. I'm the Program Director and the Radiation Safety Officer here at the Feline Radioiodine Center at Oregon Veterinary Specialty Hospital in Beaverton, Oregon. I'm really excited to share this video with you. I think it's going to offer some really good information to you as you prepare for the process. We're really dedicated to making this as stress-free for you and your pet, and I think this video will share some really important things and hopefully give you peace of mind, because it really is a wonderful treatment in a wonderful setting with great staff members looking after your cat while they're here. The three main things we'll go over during the video are, first, how the radioiodine injection is given and how it works inside the body. The next is what it's like being a radioactive kitty in the hospital. It is different than being in the regular general hospital population, but we do make our very best effort to make it as nice as we can for your cat. And then the last is how follow-up monitoring and communication will go. The radioiodine injection is a small amount of a liquid that doesn't sting. Given much like a vaccine, it's given between the shoulder blades. I give it there for a few reasons. I will shave a little spot. It is most sure for me to know that needle is in the kitty, not in their pretty fur. It doesn't help out there, makes a big mess. But also it's gentlest for the cats. They're on all four, resting on the table, eating treats or licking baby food, whatever you say is okay for them to have that you think they might enjoy. Truly a light hug for my staff. Sometimes it's as simple as light pressure on the back of their head and a light hand on their rump. And I come from behind and they don't usually even notice. We're very lucky. I call these my Zen Mondays. They're calm and I'm calm. It's just a nice day that we don't have to wrestle the kitties and have to give the injection in the vein. And we don't have to certainly aim for the thyroid gland. That's the least Zen thing I think any of us could imagine. And the reason we don't have to do that is because of how radioiodine, or iodine in general, is utilized in the body. The type of radiation that comes off of the radioactive iodine, most of it are tiny particles. They will not damage any cells that they don't have prolonged contact with. They have to be let inside of the cell to do that. So going through the bloodstream, every tissue in the body will be bathed by the radioiodine within a few minutes. They aren't harmed because they don't have gateways for iodine inside of them. Only thyroid cells do. So that's really fortunate for us. It's targeted cellular therapy with a really simple injection. It's an advanced medical procedure with, thankfully, some simpler parts for us. I like to talk about how the injection works inside the body because it really speaks to a few important aspects of treatment. One is our 95% first injection cure rate. I wish it were 100. I would do anything I could for you and your cat to make it 100, but biology doesn't work that way, and certainly cat biology doesn't work that way. I also talk about it because it explains why I have to let the thyroid run as high as possible at the time of injection. I'm really aware that I'm asking your cat to re-enter a bit of a disease state prior to our treatment, but it's for an important reason. Our 95% first injection cure rate means that some cats may remain high after the injection and need to be retreated. Those are usually more aggressive cases, but some cats can go temporarily or permanently low after the injection. When I think of the thyroid gland, it helps me to do pictures. So I picture the thyroid gland with millions of cells, and there's a combination of bad cells, right? These are abnormal cells that are at risk of converting to cancer if left untreated over the course of years. We want these cells' gates for iodine to be wide open. Hungry for iodine, they take it up and, in theory, right, die off in a nice, timely manner. But we also have many, many good cells. These are healthy cells that we want to do everything we can to preserve. That means we have to try to close their gates. There's a few manipulations we can try to do to minimize our chance of going low thyroid after the injection. Having the thyroid be as high as it will during the time of the injection helps close the good cells' gates. There's a feedback mechanism that we try to use to our advantage. As long as I'm careful with my dosing, and I really do dose quite conservatively. I give lower doses than many providers of radioiodine in the country, and I do that as part of my goal of returning to you your happiest, healthiest kitty without another disease process. Hypothyroidism, low thyroid disease afterwards, is a much easier disease to manage. I can never say the risk is zero, but we'll talk about ways that we can minimize it, and letting that thyroid run high at the time of injection is almost always done so that we can protect the good cells. It's really important that we go over what it's like being a radioactive cat in the hospital. It really is different than being in the regular population, the regular treatment rooms where someone can walk by that kennel 20 times an hour. We just can't do that when our patients are radioactive. I do that because I think it will give you some peace of mind about the setting that we have here and the care that we make every effort to provide, but also to have some just firm realities of when you're radioactive. We have a really limited ability to monitor, test, and treat because of our staff's exposure to the radiation. The treatment room is located in a back quiet corner of the hospital with 2 exterior walls. So it's well removed from the day-to-day just noises of a normally operating hospital. They can't hear dogs barking. We play classical music quietly during the day, and we have quiet time at night. And we also have Feel Away going, which is a calming scent hormone. The room is also spacious. The cats do have to be in stainless steel kennels side by side. We make them as soft and comfortable as possible, but that is part of containing the radioactivity. So they can't see other cats, but they know there are strangers next door. And that's not a comfortable situation for many cats. They don't want to be especially cramped in a small space with cats that they didn't get to vote on spending time with. Our room is quite large. The back wall is large enough where it is a floor-to-ceiling picture window, and it's a lovely setting. It looks back on a deep, deep lot. I think it's a triple lot of a dead-end street, and it's the folks' yard. So fortunately, happily, it's birds and squirrels and trees as far as the eyes can see. We have a family of bunnies that are often up to antics out there. There's a couple crows that are always playing. So it's not a sterile environment. Cats always have the opportunity to hide in a little den if they want to feel a little bit more calm and comfortable in a darker space. We call it our kitty cabana if they want, but most of the cats really spend the most time up on their shelves in their kennel looking out on the view. We call it kitty TV, and I can tell that the cats really do feel comfortable there versus a smaller room. Time and distance are the primary protective measures you'll undertake at home to reduce your exposure to the very low levels of radiation. These are the same measures I have to implement here at the clinic. That means that the staff is in the room fully gowned up in their protective gear. We're visored, we're double gloved, we have an impervious gown, and we wear booties. We're in there for about an hour twice a day. That means the other 22 hours of the day, your kitty has to be pretty self-sufficient and independent. We'll do everything we can if we notice any problems. We have gentle supportive care for gastrointestinal issues like appetite, vomiting, or diarrhea. We have anti-anxiety medications that we can give if we think your cat will benefit from it. But truly, we don't have the same testing equipment, and we don't have the same treatments available to us when the cats are radioactive. The strict isolation that the cats are in after radioiodine before they go home is one of the main reasons we talk about pre-radioiodine testing. One of them, of course, is our philosophy that we treat cats, not thyroid glands. Our goal is the happiest, healthiest cat, who's a whole cat, not just a thyroid gland after the procedure, not just a normal thyroid. That does require some investigation into their overall health. Some studies say that 20% of cats can have another disease process happening with them besides hyperthyroidism. And it's important to make sure that that won't destabilize while they're in isolation. Do we need to do some medications or treatments beforehand to make it as safe as possible to go in isolation? Or that could carry a prognosis that maybe radioiodine isn't the best plan right now for the cat. I joke that I want written on my forehead, no surprises while you're radioactive, because of the situation that the cats are in. Cats are so strong, right? They're so resilient. They can actually have even a potentially serious disease process lurking under the surface that they might not show any signs of until it's quite advanced. We know from how radioiodine works that no other tissue in the body is harmed by the radioactive material. Only bad thyroid cells are. So if a patient doesn't feel well when they go home or while they're in the hospital with us, it wasn't the radiation. It was another disease process that flared up. We always have heart and kidneys in mind. If that happens, we'll talk about that during the phone consult in depth as it relates to your cat's health history. But it could be any other disease process. So this is part of what we learn when we do the testing. I always say I do testing on my senior cats every year, that good news is great news. Or if there is something happening, at least we know now. You'll have a planned recheck, exam, and lab work with your veterinarian at 1, 3, and 6 months after the treatment. We recheck the thyroid values and their progress at those intervals because it can take time for all of those millions of cells to figure out their process and complete the process after radioiodine. Remember, we have the bad cells that in theory are dying off. We have the good cells that were senescent or asleep. That high thyroid value put them to sleep. They have to wake up and start doing their job again. It takes time for that to happen. Only about 80% of cats are at their final thyroid value at the 1 month mark. And I like to share that with people so you're not surprised or disappointed if the number isn't exactly right. The path that each cat takes in their thyroid values after the injection are as individual as they are. So some cats stay high and then finally come down. Some cats dip low, hopefully temporarily. About 20% of cats do that. And then it comes back up as the good cells start doing their normal job of producing normal levels of thyroid hormone. And some rare cats start perfect and stay perfect. Almost every cat is done with the process by 6 months, but a few cats throw us curveballs and may continue to change their number past 12 months or even more. What I do when I assess those values is I look very carefully at your history at home. I spend a lot of time trying to understand where your cat is like, both with a normal and a high thyroid. We'll do that during the phone consult. I read your doctor exam notes. It's very important to me to have your doctor's input. I pay attention to weight. I pay attention to, say, the thyroid goiter, if that nodule is getting smaller, and vital parameters. If the number isn't perfect, I take all of those considerations as I decide if we have to alter our plan. Maybe I have to add another special blood test. Or I might say we need to check a little sooner, I need to follow this a bit more closely. But as long as I'm happy with the trend of value, and as long as you feel your cat's doing well at home and your doctor gives me the okay, I almost always say, let's just give it more time. I'm a perfectionist. I wish I could have every cat perfect at 1 month, but we can't do that. And I do trust the process. After all the cats we've treated and seen the amazing response, I'll ask you to do the same. If you can help ensure that the appointments are with your doctor and that the visit notes and lab results are sent to us as soon as they're available, you'll see that I respond within usually about a week, unless I'm out of town, with a detailed assessment and plan. And I'll include you on that email just so that you can see that I'm with you and your cat all the way through this process. I really am here to make sure our end result is that happy kitty with a normal thyroid, and you'll be part of the process afterwards also. Well, thank you so much for taking the time to watch this video. It's so helpful for us to have you be prepared with this, to come with any questions. That means we can spend the bulk of our time during the phone consult finalizing any questions about this, but really focusing most of the time on your cat and working together to determine the best plan forward for your cat. Thank you so much, and I look forward to talking with you.